Hello, today I would like to talk to you about a disease called glaucoma, which is a slow and progressive disease of the optic nerve in the eye and which can lead to permanent and irreversible blindness. It is one of the leading causes of blindness today in India and all over the world, and because it is irreversible, it is extremely important for us to understand what we can do to prevent it and stop it from going to that level. Early identification of the disease and correct treatment definitely helps in preventing people from losing vision due to this condition. Glaucoma isn't a single disease, it is a group of diseases. There are two main varieties called open angle glaucoma and narrow angle glaucoma, and in India both exist almost to an equal percentage, 50-50%. People who are likely to be affected by glaucoma include first degree relatives of patients of glaucoma, people suffering from diabetes, hypertension, as well as even people who have no family history also can develop the disease. But the incidence of the disease is definitely more in people over the age of 40, and therefore to detect the condition early and to treat it early so that it does not cause damage to vision, we need to identify patients by that time, and therefore we recommend that every person over the age of 40 should definitely have a comprehensive eye exam periodically, at least once in a year or 2 years, to identify the disease if it exists in the earliest possible condition. So how does one get the eye exam? Besides just checking your numbers, the other details are also to be checked, such as the pressure of the eye called intraocular pressure, examination of the back part of the eye including the optic nerve, which can reveal very early changes of glaucoma. Also, examination of the angle called gonioscopy is also extremely important. After these tests are done, either the doctor will be able to identify that this patient has no disease at all, or he may be able to suspect. So a large number of people turn out to be glaucoma suspects, where the doctor is not in a position to immediately identify that the disease has already started, but has a suspicion that it may have. And usually suspects are put on a more intensive follow-up, and extra tests including visual fields and optic nerve scanning are to be done so that they can be followed up over time to look for progression of the disease. Patients need to understand, everybody needs to understand, that these tests may not be absolutely conclusive. So diagnosis of glaucoma may not be black and white on the first day itself. A large number of people may be labeled as suspects, and a small number of patients of these could be confirmed to have glaucoma after following up them for a pretty long time, sometimes for a couple of years or even a little more. Therefore, it has to be understood that just because you are a suspect does not mean that you already have the disease. But it's better to know that you are a suspect so that you can follow it up more intensively. The suspects need to be followed up more intensively by other tests, as I mentioned, but if everything is clear, a repeat exam just after a year or a year and a half or 2 years would be absolutely fine. For patients in whom we have been able to confirm that they have glaucoma, the treatment includes putting eye drops. Some require laser treatment, and more unresponsive cases may require surgery, which also can be more than one type. Patients need to understand that glaucoma treatment is a lifelong situation, because eye drops need to be put at a particular time on a particular regime for almost the whole life. So it has to be continued and periodically reviewed by the treating doctor to see whether they are effective, and if required, to be changed. Patients often, even after knowing they have glaucoma and have starting the treatment, fail to continue the treatment, fail to go for checkups, in which case they still land up losing vision, and that is an extremely avoidable situation which we would not like anybody to go into. The problems of preventing and people from losing vision due to glaucoma is exactly this, that people do not understand what is glaucoma, what the treatment involves, and the most important is that it requires periodic review for almost the whole life at a certain period of interval. Patients tend to give up taking the treatment and going for follow-ups at some point for various reasons, including economical as well as psychological. They feel that nothing is being done actively, so there is no need for going for the follow-up, and this itself is the biggest mistake that people make, which can end up in complete loss of vision. Patients do not understand that diagnostic tests need to be repeated at a certain period again and again to see how the disease is progressing or not progressing. Sometimes in the modern world, patients are averse to having too many eye tests, and that is the second problem in dealing with glaucoma. So I hope my little talk to you would encourage you, number one, to have proper comprehensive eye exam to detect whether early glaucoma is there or not there, and if diagnosed, to put the drops, take the medications and go for repeat tests periodically, and not to give up on this disease, because with appropriate and adequate care, definitely blindness can be warded off. Thank you.